day everyone, I am Lourdes Jane Herdistar Nablas, a level 1 nursing student from the University of the Visayas. And in this video, I will be performing my return demonstration for vital signs taking, which includes the taking of the body temperature. Vital signs are defined as the clinical measurements that indicate the state of a patient's essential body functions, whereas body temperature is the measurement of the body's capability to lose and produce heat. The purpose and significance of taking the body temperature is 1. To determine whether the core body temperature is within the normal range, and 2. To establish a baseline data. First is to assemble equipments. Here we have a disposable glove, a digital thermometer, a box of tissues, an alcohol, cotton balls, and alcohol swabs if there are any. And of course, a patient chart. This is done to save time and effort and to carry out tasks in a systematic manner. Next is to introduce yourself to the client and verify the client's identity. Ngayong adlaw, ma'am, ako di si Jane, imong student nurse. Pwede ko mangutana, unsa ganito yung name nimo, ma'am?
Ngayong adlaw po, nurse. My name is Sulel Riego.
Sige, salamat, Ma'am Sulel. This is done to ensure that we are carrying out the correct procedure with the correct client. Next is to explain what you are going to do and why it is necessary. Ma'am Sulel, karon magbuhat ta sa imuhang body temperature. Atuan ni siyang pagkabuhaton, aron ma-determinar kung ang imong temperatura sa lawas aduna ba sa normal nga range o para makatukod ta og baseline data. Nakasabot ra ba, ma'am?
Nakasabot ra.
Salamat, Ma'am Sulel. Providing information to your client will minimize fear and anxiety, will foster trust, and will promote cooperation. Next is to wash your hands or perform hand hygiene. This is done to prevent the transmission of harmful pathogens during the administration of health care. Next is to provide for client privacy. If you are in a ward, be sure to place curtain drapes around the area of the bed. If you are in a private room, be sure that the doors are closed and adjust curtains if there are any. Providing privacy is the client's basic right. Through this, we can establish rapport and promote client's comfort and cooperation. Next is to place the client in an appropriate position. Ma'am, pwede ta mo isbog naman ani, ma'am?
Oo.
Apang i-adjust imong pillow, ma'am, ha?
Oo.
Kana, ma'am, okay ra kana, ma'am? Komportable ra ba ka?
Oh, thank you, nurse.
Sige, salamat po, ma'am. Correct positioning will promote good body mechanics and will ensure that the client is in a comfortable state. It will also enable the nurse to attain accurate temperature reading. Next is to place the thermometer. For oral temperature taking, Disinfect from bulb's end towards the battery cup and place the bulb on either side of the frenulum and disinfect afterwards. Oral thermometers must be disinfected to prevent cross-contamination. As for the rectal temperature taking, apply clean gloves and instruct the client to take slow and deep breaths and insert 3.5 centimeters in adults. Gentle insertion will decrease discomfort to the client and will prevent trauma to the mucous membrane, which eases the insertion of the thermometer. As for the tympanic temperature taking, pull the pinna slightly upward and backward for adults and pull the pinna slightly downward and backward for children and point the probe slightly anteriorly towards the eardrum to attain accuracy in temperature reading. And as for the axillary temperature reading, which I will be doing for this procedure, is to pat first the axilla dry if moist. This is because moisture can alter the temperature reading. Ma'am, mag-wipe ko sa imong ilok, ma'am, ha? Next is to place the bulb at the center of the axilla in order to attain accuracy. Next is to wait for the proper amount of time in order to attain accurate temperature reading. Next is to remove the thermometer for the nurse to assess the results. Next is to disinfect the thermometer to prevent cross-contamination and the spread of nosocomial infections. Lastly, document the temperature results in the patient record. Documentation provides coordination of care and facilitates ongoing data collection. A well-written and detailed record of the client will serve as a foundation for an efficient nursing intervention.